Hi everyone, I'm Alice.
And I'm Jessie.
And this is
Waterfront Wednesdays,
brought to you by Boston Harbor Now. Today, I'm joined by Jessie Partridge Guerrero, who is the research manager at MAPC, the Metropolitan Area Planning Council, which serves as the regional planning agency for the 101 cities and towns of Greater Boston.
It's great to be here.
On past episodes, we have talked about climate change vocabulary, and we've talked a lot about how the harbor walk and the islands and buildings and infrastructure will be impacted by sea level rise. But today, we're going to focus on the people and how they are and will increasingly be a subject to the climate crisis. We're going to talk today mostly about vulnerability.
That's right. So in general, there's a move to transition from conversations about polar bears to talking about what people actually experience. And even within that, while we want everyone to be on board with ways to address climate change, we also have to recognize that it impacts different people differently.
And before we go too far in vulnerability, I want to talk a little bit about why we are here as a team together. We were on a panel where you talked a lot about the regional approach to climate change that MAPC works on.
Yeah. So of course, one of MAPC's roles is to convene and provide policy support to the Metropolitan Mayors Coalition, which is a group of mayors and municipal CEOs from 15 municipalities in the inner core of Greater Boston.
There are a lot of issues that transcend municipal boundaries, transportation, housing, but nothing ignores lines on a map quite like climate change.
That's right. That's why since 2015, the Metro Mayors have convened a climate preparedness task force that strives to ensure its member municipalities coordinate and integrate strategies on mitigation and adaptation, while also ensuring that vulnerable populations in their communities have protection and adaptive capacity in the face of climate change.
So fast forward a few months, I was at a meeting about MetroCommon 2050, which is the regional plan being developed by MAPC, and I learned about some of the research you've been developing.
Yeah, so the research team at MAPC, which is part of the Data Services Department, has developed a research agenda for MetroCommon that asks big questions about strategic topics to help us understand what Greater Boston might look like in 2050 and to help us determine the steps and strategies we need to get to the vision that we and our constituents have for the region at that time. Our research covers a range of topics from the changing nature of work to dockless bike share to climate vulnerability.
And it was that vulnerability analysis that was unlike most of the climate conversations that I get to be a part of, which are normally focused first and foremost on the built environment.
Yeah. So for this work, we wanted to identify communities at the local level that might be most vulnerable to climate-related impacts. We also wanted to understand how future climate-related storms and flooding might impact vulnerability in coastal communities. And we wanted to use findings from our research to inform MAPC's climate work with municipalities and to really help us prioritize and focus our efforts on those communities most vulnerable to climate impacts.
Yeah, so you're taking a bunch of academic papers and you're trying to figure out how to take their methodologies into applied research about the people in Greater Boston.
That's right. So it was really important to us that we bring together the physical elements of climate change, thinking about that built environment and how climate will impact it, with the human element, bringing into the conversation expertise from public health researchers, housing advocates, workforce development experts, the community, and others, and about how climate change actually impacts people and how it impacts them differently, so that we can focus at the intersection of physical and social vulnerability.
So in the way you've described your research to me, there are 3 dimensions to vulnerability. The first dimension is exposure.
Yes. So exposure is when vulnerability is defined by the proximity of an individual or group to a hazard, stressor, or disturbance. So we looked at exposure to extreme heat and to flooding.
So it's geographic. How close are you to a thing? And in this case, the thing is either a place where there are less trees and more concrete, and that means that you're experiencing heat island effects or really extreme heat more frequently or more acutely. And then on the other side, it's do you live near a river or on a coastal area or in a place where it's low-lying, where a storm comes and you get flooded out.
Yeah, that's right. It can also be employment related. So we also considered workers with a high degree of exposure like firefighters, construction workers, farmers, fishermen, forestry workers, things like that.
Great. And the second group of vulnerability or vulnerable people you looked at was a category called sensitivity.
Yes. So sensitivity is a function of the pre-existing social, economic, and political conditions of a given group or community and how those conditions influence access to resources and exposure to hazards.
So these are people who might generally have a harder time, but are really acutely aware of the fact they're sensitive to this heat or flood. So it could be someone who's really young, someone who's really old, someone who's a disability, maybe a heat health condition like diabetes or heart disease or asthma. It might be someone who's living in a really crowded quarters, someone who, is just feeling anything that happens with climate change. It's just that much more acute.
Yeah. So we might think of these groups as more vulnerable generally, but they're especially sensitive to those really hot days or to those flooding events. So especially if a flooding event leads to a power outage, they might be more likely to need hospital care. They might have trouble getting to a hospital if needed, or they may simply need power for a medical device.
And the third dimension of vulnerability you studied was adaptive capacity.
Yeah. So people or groups are vulnerable depending on their ability or lack thereof to plan for and adapt to changing conditions using social or technical skills, resources, or different strategies.
Yep, so this is the can I escape from this situation group, either literally or metaphorically. It's looking at people or populations who either can't escape, or if something really bad happens, they have trouble rebuilding or bouncing back quickly.
Yeah. So for this adaptive capacity metric, we considered households without a vehicle, households without internet access, families living below the poverty line, or or people without health insurance, as well as other indicators of social or political vulnerability like race and ethnicity, linguistic isolation, and people over 65 living alone.
And then you did math. You created a climate vulnerability index, which is designed to combine those data across the three categories, stick it into census tracts, and then identify what the geography was for these forms of vulnerability.
Yes, and of course we mapped it. So when you look at this map of populations vulnerable to flooding, it's not surprising to find them along the coast, but you can also see where the aggregate effects of these social vulnerabilities play a role. So places like East Boston, also places like Revere and Lynn, and also inland flooding where you might be near a river or you might feel the impacts of rain, places like Framingham.
And in some cases, the data can be used to drive state or federal policy or investments. So you might have shoreline infrastructure as a physical intervention. There's a river protection of some kind. What's going to protect those residents on the ground in those specific places?
Mm-hmm. Right. So now if we compare to this map of heat vulnerability, we can see there are similarities and differences for heat vulnerabilities. Here, most of Boston, as well as places like Everett, Chelsea, Malden, Revere, are going to be impacted. So a lot of those places in the inner core of the region with lots of concrete, fewer trees, things like that.
Yeah. But interestingly, none of these communities are that far from the water. So in addition to increasing the tree canopy, you can also connect people with the water, have better access, whether it's a harbor walk or more parks or beaches. These are all actually ways people can go cool off.
Yeah, I love that idea. In addition to these nature-based solutions, this is also a way to strategically locate cooling centers, spray parks, places, more public spaces with air conditioning, things like that.
Yeah. So what's next for this research?
Yeah. So as you can see from these maps, we really did this research at the regional scale, looking at the kind of local data, but for the whole greater Boston region. What we want to do next is be able to zoom into individual municipalities so that as we're working with municipal planners, we can really get them thinking about the social vulnerabilities to climate in their planning.
And that allows people who work for municipalities, planners, and others to do their climate action plans, use it for their MVP grants from the state.
Great, yeah. We also want to look at some of these individual risk factors. So looking just at populations 65 and older living alone, or populations with asthma or diabetes, so that we can understand where those individual groups are most vulnerable so that we can kind of plan for strategic interventions for them.
And then you can work with the public health officials who are monitoring those situations in those communities and pair that up.
Exactly.
So cool.
So thanks for tuning in. I'm Jessie Partridge Guerrero.
And I'm Alice Brown.
You can follow MAPC on Twitter at MAPC Metro Boston.
And you can follow me at Fairy Fairy.
If you like this video, please share it with friends or subscribe to this YouTube channel.
You can throw us a like or leave a comment below.
We'll see you on the waterfront.